So the diagnostic process for patients with adult ADHD is uh, in some ways fairly simple, but can actually be slightly complex because it involves uh, a lot of time to first of all understand whether or not there are any other problems that the people might be having that mimic or are similar to ADHD. And one of the commonest uh, things that I normally tend to see in ADHD diagnostic process is some other neurodevelopmental problems or comorbid problems such as mood disorders or certain personality related difficulties that may come across as ADHD. Uh, so the process, we are getting more and more efficient in the diagnostic process. And what I personally have started using and doing in my private practice is to use certain objective computer-based tests before we go into the core diagnostic interviewing process. And that computer-based test is called QB test, and in other ways it is also available as QB check. So what that essentially does is it helps people to go through a software program that starts recording the different symptomatologies that people may have in adult ADHD, and that gives a very good marker in two dimensions. One, it helps in ensuring that we are heading more towards the ADHD process. And once that comes about, the total scores and the graphs that I get out of that, they can chart out the amount of quantitatively the difficulties in symptoms that people have, which then can later actually be very useful in terms of treatment monitoring. So once people have started off on medications, they can themselves see the improvement objectively by repeating those tests. So that's one component of that. So after the QB test, then it involves essentially ruling out other possible psychiatric problems, which, as I earlier mentioned, may be mood disorders or personality related difficulties, emotional problems, followed by a comprehensive, structured diagnostic interview that involves not just the patient but also, if possible, the patient's family or the caregiver who knows more about their early developmental years and schooling years, along with some school reports. The medications for ADHD are largely divided into two categories. One category is of stimulant medications, and then there is the category of non-stimulant medications. And then further research and evidence is coming through for some other group of medications as well. But generally speaking, the first line of medications are the stimulant group of medications, and if they don't seem to help, then we tend to go on the non-stimulants. But in my experience of treating ADHD, what I have started to notice is that there is clearly a role of combination medications as well, which means that sometimes some people may have certain adverse effects to the stimulant group of medications, and in those instances, combining a non-stimulant can be very helpful, not only by helping them to reduce the side effects or adverse effects from the stimulants, but also I've seen that the amount of medication needed for the stimulant, that total dose can gradually be reduced, and the balancing of efficacy versus the side effects can be much better achieved. Response to medications, in my experience, uh, by and large, majority of the people I've seen have responded well to medications. Sometimes it may take a little while to fine tune the medications for people, such as if we were to start them on one group of stimulant medications, and if they don't respond to that, then it is a case of trying a different one for several weeks. Uh, Adding in or removing some, combining with the non-stimulants. So various permutations and combinations are important, and I think that is where the expertise of treating ADHD comes in, rather than having a box standard way of treating everyone with the same medications. It's important to fine tune and tailor the treatments as per the needs of the person. Now, if people don't respond, or sometimes people don't prefer to take medications, so my approach to the overall treatment for ADHD is thinking about a multimodal management, which means that not just medications, but having medications alongside that, optimizing different difficulties that most people may face, such as having sleep difficulties, and including something called as neurofeedback. And in neurofeedback, what we tend to do is we look at the brain waves via doing an EEG, which then gets transferred onto a computer software, which gives us the uh, ratios of different frequencies or brain frequencies that people have. And we train the brain to alter those frequencies to allow for the symptoms to be improved. Now, that currently is not very widely used in UK. It is used quite a lot in Europe, and I'm hoping that as part of the treatment package, I'm hoping to start offering the neurofeedback as well. So, uh, when we come to thinking about what happens if someone doesn't respond to medications, then I think the my approach has always been that it's not just medications alone, but a combination and a package for the treatment for ADHD and the symptoms associated with that. CBT can be an important component, as I earlier mentioned, as part of the multimodal package or multimodal treatment options for ADHD. So CBT by itself means cognitive behavioral therapy. So what it does is it starts to understand the thought processes, and as a result of those thoughts, what behaviors people engage in. And if we were to modulate any of those two, either the thought processes or the behaviors, then we expect things to improve. So in the case of ADHD, what I found is CBT can be very useful for the practical day-to-day management of people's difficulties. For example, many people with ADHD have executive dysfunction, which means that their planning, their organization, their timekeeping is not that good, which affects their day-to-day functioning and their productivity. So CBT can help in trying to give them practical ways to engage in certain strategies to improve their executive and organizational difficulties. So I think that is an important component of the overall treatment plan. Best results generally are found by the combination of medication, CBT, sleep optimization, neurofeedback, nutritional management. So, uh, we can't say one thing is better than the other, but the best results are often seen when we start looking at the treatment for ADHD as a combination of several components, which include medication, CBT, and the other modalities of treatment. what I normally explain to my patients is that with the current evidence that we have, medication is effective once they are taking it and the symptoms are well controlled. What happens is once the medication is stopped, the symptoms can return back. And sometimes we will confuse that as being dependent on the medications or the risk of being addicted on those. So that is an important thing to clarify, that any person who's on any medications, and if they stop the medication, uh, they would have a withdrawal effect from that drug, which doesn't necessarily mean that they are dependent. So that's number one. And in terms of the efficacy with the medication on the symptoms, what I've generally seen is that once people do stop, then the symptoms can return back. And that is actually quite okay for quite a number of people, because uh, the medication can be used during the most productive hours of the day. So, for example, I have people who work during the daytime, and the most productive hours of their day need to be between 9 and 3. So, taking the medication after breakfast can be very helpful for them to get the maximum effect from the medications. And if they don't need to be productive, they don't need any medication in the evening times, or maybe in the on the weekends, so they can choose not to take the medication during those times. uh, that is one of the if I may say, not drawbacks, but one of the known facts about medication, that you know it is only effective till the time they are taking them. And that's where the other modalities of treatment can become very handy, where uh, if there is an improvement in the sleep side of things, there is an improvement with the brain training using neurofeedback, uh, the dietary changes, plus whatever they learn practically from the CBT can be far more sustained, and those effects or those benefits can last longer, as opposed to just the medication by itself. So I think I just wanting to re-emphasize that it's not just medication or CBT, but it is a combination which needs to be tailored to the individual person, which is what uh, uh, I think works best for that individual.